When a plastic surgery gets botched, it can make life miserable for a patient. Our patient from South India underwent a liposuction in his local city, and unfortunately, it was a mess. We can see from the pictures that the entire liposuction was just a screwed up job. There was skin necrosis. Forget burns, it just went ahead. There was actual loss of skin, indentations, skin all over the place, extremely hard tissue, and the confidence of the patient was there. He could not look at himself in the mirror. He was scared. His children could not see him. And he was in a bad state, because when you look at this image of yourself, you don't want to see yourself again. And in that state of mind, this patient came to us seeking a correction. And it is an extremely, I think, one of the most difficult cases of our career, where initially I thought, well, I can't do anything about it because this is just too bad. Imagine loss of skin, burns, severe burns inside, inadequate liposuction, too much liposuction, just too bad. But he insisted, and we thought, let's take it up as a challenge, and we decided to do what we could. So we tried to even out. We did liposuction, we did fat injections. He wanted a sort of a six-pack, chest pack, deltoids, biceps. He wanted to get all the confidence back again. So we even then planned a tummy tuck. We wanted to remove all the dead skin that there was. We wanted to remove all the burnt skin. Unfortunately, we couldn't remove all. But we did a tummy tuck. We were able to free the skin a lot. We were able to contour it so much better. It became much, much better. In fact, so much more presentable. Unfortunately, we couldn't get the six-pack lines in place because of the intense swelling. But you can see the deltoids and the biceps and the chest pack. Absolutely beautiful. They came out beautifully well. The patient now wants to further refine. He actually wants a proper six-pack. So today, we are planning to do an extended tummy tuck, remove some of the extra skin by the sides, and we are going to fashion out a nice six-pack for him. He wants more refinement of his chest pack as well as deltoids. So we're going to do more injection of fat into the deltoids and the biceps. And we're going to define the lower arms also in a better manner. We're going to chisel out his back a little bit more and create a better back and buttock junction. We are also doing permanent threads today for our patient. He wants a permanent lift. He doesn't want a facelift surgery, but he wants something non-surgical. So we're doing permanent threads to lift up his face as well as the neck. So we're going to flatten the neck and lift up the face. He's doing all this for confidence. You see, if plastic surgery goes wrong, then it's very difficult to rescue it. It becomes virtually impossible to rescue it. So it is important that you as a patient must always and always select a plastic surgeon who is qualified, experienced. You may go to a younger plastic surgeon, but make sure that younger plastic surgeon has affiliation or has a collaboration with a senior person, because you don't want low experience and low skill to jeopardize your results. So it is essential that someone needs to supervise your procedure, otherwise you will not get a great result. And as you stick to better, more qualified doctors, you will obviously get much, much better results.